10 silent red flags your cholesterol is dangerously high, and you don't even know it. What if your body has been trying to warn you for months? Have you ever felt tired for no reason? Or noticed a strange flutter in your chest? Maybe you've blamed it on stress, aging, or just a bad night's sleep. But what if those small, easy to ignore symptoms were your body's quiet cry for help? Hi, I'm Dr. William Harris. After more than 30 years treating heart patients across America, I've seen one truth over and over again. The deadliest threats to your health are the ones you don't feel until it's too late. High cholesterol is one of them. It builds up slowly, quietly clogging your arteries. Then one day, it strikes, with a heart attack, stroke, or memory loss you never saw coming. But here's the good news. Your body whispers long before it screams. Today, I'll walk you through 10 of those whispers, subtle but serious signs your cholesterol may be dangerously high. If you notice more than one, it's time to act, and I'll show you how. Let's begin. 1. Fatty skin deposits, xanthomas. Have you ever noticed soft, yellowish bumps under your skin, maybe near your eyes, elbows, or knees? They might look like skin tags or harmless growths, but they could be something much more serious. These are called xanthomas, fatty buildups that form when cholesterol leaks into soft tissue. It's your body's way of saying, there's too much cholesterol in the bloodstream, and I don't know where else to put it. They're not painful, but they're loud visual clues that your cholesterol levels may be dangerously high. Don't ignore what you can see, because what's hidden inside your arteries could be even worse. 2. High blood pressure. If you've been told your blood pressure is high, ask this important follow-up question: how's my cholesterol? That's because cholesterol and blood pressure are deeply connected. When plaque lines your arteries, the opening narrows to push blood through that tighter space. Your heart works harder, and your pressure rises. Taking blood pressure pills without addressing cholesterol is like mopping the floor while the faucet is still running. Check both, and manage both. 3. Chest pain or pressure, angina. Have you ever felt a strange pressure in your chest during stress or exercise? Not sharp pain, just tightness, like someone pressing down on your chest. That could be angina, a warning that your heart isn't getting enough oxygen. When cholesterol builds up in your coronary arteries, it restricts the blood supply your heart needs. Left untreated, it can lead to a full-blown heart attack. Don't dismiss chest discomfort, especially if it spreads to your shoulder, jaw, or back. Your body is trying to tell you something. Listen. 4. Rapid or irregular heartbeat, arrhythmia. Does your heart sometimes skip, flutter, or feel like it's racing out of nowhere? That's not always stress or caffeine. It could be a signal that your heart is struggling to push blood through clogged arteries. When arteries are narrowed by cholesterol, your heart may beat faster to keep blood moving. If your resting heart rate is over 100 beats per minute, it's time to ask your doctor why. An erratic heart is often a tired heart. 5. Erectile dysfunction, men. Let's talk honestly. Erectile dysfunction isn't just a men's health issue, it's a circulation issue. If blood flow is limited down there, it might also be limited elsewhere, including your heart. The tiny arteries that support healthy function are among the first to clog with cholesterol. For many men, ED is the first sign of a vascular problem. Don't just reach for the blue pill. Reach for a cholesterol check. 6. Numbness or tingling in the extremities. Do your hands or feet ever feel numb or tingly? Especially at night? You might think it's nerves, and sometimes it is. But often, the real issue is circulation. When blood can't flow freely through your limbs, oxygen-starved nerves start acting up. This is called paresthesia, and it's a red flag that cholesterol may be clogging your peripheral arteries. Your body's telling you, I need better blood flow. 7. Vision problems. Blurred or double vision isn't always an eye issue. Sometimes, it's a heart issue. Your retina and optic nerve rely on small, delicate blood vessels. If cholesterol blocks those vessels, your vision suffers. If you're experiencing vision changes in both eyes, especially suddenly, it's time to consider a vascular cause. Your eye doctor may save more than your sight. 8. Dizziness or lightheadedness. Have you ever stood up and felt like the room was spinning? Or had to grab something to steady yourself? Dizziness can come from many things, but poor blood flow to the brain is one of them. If cholesterol is narrowing the arteries that supply your brain, you may feel weak, unsteady, or lightheaded. This is especially serious if combined with blurred vision or headaches. Don't shrug it off. 9. Fatigue that doesn't go away. We all feel tired sometimes. But if you're sleeping well and still feel drained every day, something deeper may be going on. When cholesterol restricts blood flow, your organs and muscles don't get the oxygen they need. You feel tired, sluggish, like you've aged 10 years overnight. If this sounds familiar, and other causes have been ruled out, cholesterol could be the hidden culprit. 10. Memory loss or brain fog. Struggling to remember names, appointments, or where you put the keys? Having trouble focusing or finishing your sentences? These might be early signs of cognitive decline, and cholesterol may be playing a role. The brain needs rich, oxygenated blood to function. When arteries leading to the brain are clogged, memory and clarity begin to fade. It's not just aging, it could be your cholesterol, and it's worth checking. When to be concerned. One of these symptoms alone may not mean much. But if you recognize several of them, especially if you're over 45, have a family history of heart disease, or live a less active lifestyle, don't ignore the pattern. Your body is smarter than you think. It whispers before it screams. What you can do right now. Here's the part one want you to remember most. High cholesterol is treatable. You can take action starting today. Get your cholesterol tested. It's a simple blood test. Do it every 4 to 6 years, or more often if you're at risk. Change your plate. Choose foods that fight cholesterol: oats, beans, fish, olive oil, vegetables. Get moving. Just 30 minutes of walking a day can make a huge difference. Quit smoking. It damages artery walls and speeds up plaque buildup. Work with your doctor. You might need medication, and that's okay. It saves lives. Final words. Your future is in your hands. I've watched too many people ignore these signs until it was too late. But I've also seen people turn their lives around, avoid heart attacks, and live longer just by catching these symptoms early. So take a moment. Think about your body. Are you listening to it? Because it might be whispering right now. And today, you still have time to respond. Thank you for watching. Take care of your heart, and it will take care of you. Dr. William Harris.